Good day, ladies and gentlemen. I hope you have enjoyed the meeting thus far. It is a true pleasure for me to be here with you today as we commence the presidential plenary. This plenary will include my address and reflections of my time as president, an outstanding advocacy component that will include the World Ovarian Cancer Coalition and the launch of their charter. Some remarks from Dicey Scroggins, our Director of Global Outreach and Engagement, about the importance of advocacy at the IGCS. And finally, our annual business meeting. It has been quite a year for all of us. COVID has changed the world in so many ways, and the way we conduct our practice, care for our patients, and our own daily lives. As I stated in a recent presidential perspective, there is still so much to learn, behavior to change, data to gather and analyze as we move forward. I have enjoyed over this last year using the presidential perspective messaging to share my thoughts, ideas, and provide updates to the activities of your society. I'm proud of the manner in which the IGCS Council has shown strong leadership and taken decisive actions to embrace innovation so we could meet our goals in service to our members, partners organization, and the gynecologic cancer community. Many of you may find yourself in leadership positions, and the effective leaders are now more important than ever. IGCS continues to strive to be more and more inclusive of all individuals and groups providing care to women with gynecologic malignancies. Through our programming and services, we are now more than ever purpose-driven and working towards meaningful change. During the last 2 years, we increased not only the partnership with international scientific societies, but also we enhanced the sense of belonging to IGCS in developed and developing countries. We initiated a robust advocacy and community-centered program thanks to the collaboration with patient associations worldwide. My thanks is for these associations, for their support, for helping to collaborate with us, sustaining an active, empowered global advocacy network with IGCS. For these reasons, we are allowed to let Patients Association to actively participate to the Congress. IGCS must continuously grow and have the humility and empathy to better understand the challenges our colleagues in some parts of the world face each day and what these patients endure. IGCS, by identifying what resources we have and seeing what others need, is making a difference globally. I'm heartened each and every day when I reflect on the thousands of volunteer hours given freely by our members who want to be engaged and involved in the IGCS. I receive emails from members all over the world who have the strongest of desires to give back and have found at home in IGCS to do so. It might be participating in a project's eco tumor boards or hosting a visiting scholar to observe your practice, giving your time to our educational mission, participate in our advocacy efforts, and the list goes on and on. Thank you all very much for your continuous support of the IGCS. We continue to find ourselves at the forefront in the global fight against gynecologic cancer and stay true to our mission to enhance the care of women with gynecologic cancer worldwide through education and training and public awareness. In the spirit of our mission and the current heightened global awareness of and attention to social and health inequity, I'm proud that IGCS is issuing in the coming week a statement outlining our position on these important matters. To be blunt and very clear, IGCS supports all who espouse social and health equity around the globe. The IGCS Council is confident that this will stimulate the dialogue and discourse, and that we welcome your comments and thoughts. It is our commitment to keep these at the forefront of our agenda moving forward. At the most importantly, it promotes programming and actions that improve the lives of girls, women, and communities worldwide. I'm grateful to so many who have impacted me professionally and personally. Special thanks to my mentors, leadership and staff of IGCF, and most importantly, my wife and my 5 children. Our next portion of the presidential plenary will include a presentation from the World Ovarian Cancer Coalition, the WOCC. Before the WOCC presentation, let me share with you a very emotional event organized by IGCS in the city of the Vatican yesterday. The Pope spent the morning with a delegation of the IGCS and the Oncologic Patient Associations able to travel to Rome despite the COVID restrictions. He welcomed the annual meeting of the IGCS and encouraged the various non-profit organizations of any religion devoted to the care of patients affected by gynecologic neoplasm. At the end of the day, the Vatican graciously provided a video from the day's event. It will be played at the end of today's sessions and also during the Advocacy Patient Caregiver Summit in 2 weeks. Now, please allow me to welcome Elisabeth Baugh, Chair of the WOCC, and Francis Reid, Program Director. Elisabeth.
Thank you so much, Professor Angioli, for this incredible opportunity and for the interest and engagement of the International Gynecologic Cancer Society. I hope that our joint efforts as strategic advocacy partners will lead by example and be a powerful testament to bring together patient and clinical voices at a local, national, and international level. To those of you watching, yes, the Global Ovarian Cancer Charter is an initiative of the World Ovarian Cancer Coalition, but it is our charter for all of us investing in driving improvements in survival and quality of life for women with ovarian cancer, no matter where they live. If you haven't heard of the World Ovarian Cancer Coalition, we are a coalition of over 160 patient organizations in 47 countries, and we've now expanded our free membership to clinical groups as well. I'm sure our vision is your vision too, and our mission is to empower the global ovarian cancer community through knowledge, collaboration, and action. In 2018, we undertook the Every Woman Study, the largest ever consultation with women who had ovarian cancer. 1,531 women in 44 countries took part. There was a literature review, and we consulted widely with the clinical community. The shocking findings, recently published in the International Journal of Gynecologic Cancer, laid bare the immense challenges women face dealing with this disease. But there was hope, because for a wide range of measures, there was large variation between countries offering the opportunity to share learnings and drive improvement. No one country had all the answers. Articulating those challenges, showcasing great work, and inspiring action are central to the Charter. No matter where you are in the world, we believe the Charter will bring a focus and shine a light on the need for urgent progress in your country and all our countries, and show possible ways to achieve it. We hope you will want to be part of it and that you will sign up today to show your support. For more details, I now pass you over to our Program Director, Francis Reid.
Thank you, Elisabeth. The Global Ovarian Cancer Charter is a call to action for all of us committed to improving survival and quality of life for women with ovarian cancer. The 6 global goals that underpin the Charter focus on raising the profile of this disease, improving times to diagnosis, best possible care and clinical trials, ensuring opportunities around family history are not lost, and improving data and information and support for women. It's very easy to get involved. All you need to do is scan the barcode that you see in the bottom right of the slide with your phones, or you can go to our website and follow the link. We will guide you through the rest. And the easiest way to engage is to become a Charter supporter as an individual or an organisation. The second way, though, is as a charter champion, and they are quite literally inspirational, and they show the charter in action. They promote the charter to their networks. Once you supply some basic information, we work with you to showcase current or planned projects that speak to one or more of the goals, depending on your priorities. This is what some of our early champions have already done. The 6 goals of the Charter are equally important, but we always start with this one. Global cases of ovarian cancer are set to rise 50% by 2050, with developing countries bearing the highest burden. Policymakers and funders need to realise that the time for action is now, so that all of your and our efforts have the best chance of success. It may be you need to start this type of activity. Champions GOSON in Nigeria are doing so, initiating a high-level advocacy programme. Or you may be further along the line, like Ovarian Cancer Australia, who have led a collaborative effort and secured multi-million-dollar government funding to improve treatments and support. Our next goal, rapid diagnosis, and worldwide a shocking number of women are too unwell to receive or tolerate any treatment and die shortly after diagnosis. Our study, we missed these participants, but for us, the average time in the study from symptoms to diagnosis was 6 months, with a wide variation by country. Women need to know about the symptoms and when they should seek help. Doctors need to know about the symptoms in order to consider ovarian cancer, and then they need to be able to access timely tests. Awareness campaigns like our own World Ovarian Cancer Day, each May the 8th, or Engage's Go Day later this month, all play their part. In the UK, Champion Target Ovarian Cancer has training developed with the Royal College of GPs and British Medical Journal aimed at family doctors. There is so much we can do and so much we must do. There's also so much to be done around our goal on best possible care to improve the accessibility of affordable, essential medicines, technologies, trials, and surgical oncology right around the world in low and high income countries. There are projects on a systematic level, IGCS's own flagship global curriculum and mentorship programme, developing expertise in surgical oncology in low and middle income countries. There are projects on a national level, for example, Ovarian Cancer Canada's State of Treatment and Outcomes of Ovarian Cancer, or programmes to help individuals, such as the Clarity Foundation's Treatment Decision Support Programme for women in the United States, based on their molecular and genetic profiling. Action around family history is so important to women, so they can access the best treatments and that other women at risk can be identified. Yet access to genetic testing and counselling varies enormously. In our study, rates varied from 10%, that was pre or post-diagnosis in Japan, to 81% in the United States. It is virtually non-existent in many low-income countries. There is hope though. Kolkata's Gynae-Oncology Group are working with their patients to pilot family history camps and trial less frequent, more affordable, but no less effective PARP inhibitors. In the United States, FORCE have incredible expertise in advocating on behalf of women with an inherited cancer risk, helping change laws and insurance practices. And Bright Pink help women quantify their own risk and provide information about risk reduction. Together, we must improve the quality, the quantity, and the diversity of data around ovarian cancer. As you know, it's not one disease, and many factors such as ethnicity and location affect what type and what age women might develop it. The Global Initiative for Cancer Registry Development tells us that only 20% of low and middle income countries have the necessary data to drive cancer planning and policy. Nigeria are taking their first steps with a network of hospitals now collating data to inform decision-making and identify risk. Other champions are trailblazing underrepresented groups. Nogo in Germany are leading the work on the characteristics of long-term survivors. And we ourselves are progressing plans to bring the Every Woman study to a number of low-income countries where patient experience data is almost non-existent. Our last goal, but not least, is to improve information and support for women at diagnosis and beyond, and meeting their physical and mental well-being needs. And there are many, many great examples from our champions, from Survive and Thrive by the Sandy Rollman Ovarian Cancer Foundation, to Ovarian Cancer Australia's Teal Support Programme based on case management, or the ever-popular Resilience Kit, to improving access to psychological support, such as ASICO's programme in Spain. We hope that you are inspired by the Charter and these organisations to find out more. Why not be first in line to join them as a supporter or a champion? Scan that barcode on the screen in front of you or visit our website, and you'll be able to read more about the Charter and these incredible projects. This, though, is just the start of our work with the Charter. It'll be a living document, and over the course of the next 12 months, we'll update you on progress and bring you a series of virtual events focusing on each of the global goals, and we'll be adding new champions all the way. We kick off on October the 22nd with the launch of our review of global incidence, mortality and survival, and a summit, a virtual summit on global inequalities in ovarian cancer. We hope you'll want to take part. Please join us and this fast-growing group of patient advocacy and clinical groups so that we can be more powerful together. Just scan the barcode to get started, and we do look forward to hearing from you. Thank you.
I'm very impressed. Thank you very much, Elisabeth and Francis, for your presentations, and more importantly, for sharing with us the outstanding work the WOCC is doing for women with ovarian cancer. Now, I would like to invite Dicey Scroggins, the IGCS Director of Global Outreach and Engagement. She will tell us about the upcoming plans of the IGCS. Please, Dicey.
Thank you, Roberto. Thank you, Dr. Angioli. Thank you. I appreciate all the comments that were made by Elisabeth and Francis. They're very important. The strategic advocacy partnership between IGCS and WOCC is a clear example of the action-oriented relationships being formed through our advocacy programs. And IGCS is truly pleased that WOCC has launched its charter at this meeting. Thank you, WOCC, for your foresight in conducting the Every Woman study and in developing the charter. The IGCS mission, simply put, is to best serve women and girls, specifically relative to their gynecologic cancer, risk, care, and outcomes. And I start almost every presentation with a tribute that's on screen as a reminder of why, for whom we are here today, virtually. And it is an anchoring statement that I wrote many years ago. So instead of simply calling this area of IGCS emphasis advocacy, we call it global outreach and engagement, because this aptly describes what we do every day. We reach out to and engage individuals and organizations around the world, building capacity and facilitating connections to create chains of collaboration, magnifying the likelihood of benefit to gynecologic cancer patients and their communities. In brief, over the last year and a half, global outreach and engagement has formally embedded itself throughout IGCS programming. Among other things, we have enhanced our advocacy web pages with a greater depth of information, and so it is a much more important source of information to patients around the world in any setting. We've established the Distinguished Advocacy Award. It is the first international award specific to gynecologic cancers. We've developed the Strategic Advocacy Partnership Program, which you heard just a little about a few minutes ago. We held a survivor caregiver symposium, Yes to Survivorship and Empowerment, in Rio. We've co-hosted and participated in health-focused webinars. We always, in these webinars in recent, because of the current environment, discuss specific information to COVID-19. So we are always holding relevant topic-focused webinars. We established the Global Patient Perspective Roundtable Series, through which topics specific to patients are explored in multi-stakeholder sessions. We assisted in drafting the Global Health Equity Statement IGCS is releasing soon. And on September 26th, we're holding a free 4-hour virtual Survivor Caregiver Public Summit. Please join us if you can. And we are in the early stages of forming a global gynecologic cancer advocacy network. All advocates and advocacy organizations are welcome to participate in this non-competitive, forward-facing, action-oriented collaborative. Stay tuned, we're just getting started. As IGCS leads the globe in the fight against gynecologic cancers, let me emphasize the fact that we are focused on optimizing both survival, how long one lives, and survivorship, how well one lives. In every setting and under every circumstance, this is not an either-or proposition. It's not that you get to have one or the other. Women everywhere deserve to and have a right to both. And while this might seem self-evident, practice and outcomes would lead one to believe otherwise. We have to do better. At IGCS, partially through our global outreach and engagement efforts, we approach these linked imperatives bolstered by the power, the courage, and the resilience of patients as within our collective ability to achieve. So we will. In closing, let me tell you about a small Kenyan village that exemplifies the power of collective action and networking. That's what advocacy is at its core. My daughter Aneka and I visited the village in 2005. All the men had died of AIDS. The women supported the village through basket weaving. They also wrote and performed plays about HIV infection and AIDS to share with neighboring villages, even given the stigma and the shame often associated with the disease, and with the possibility of backlash. If under such circumstances, these women can persevere, push forward, advocate for others, then I believe that nothing is beyond the reach of a group of dedicated, passionate people anywhere and under any circumstance on the planet. In our mission to reach girls and women in every circumstance and to optimize their health and well-being, we must be as courageous and as clear in purpose. Thank you.
Thank you very much, Daisy, for your exceptional contribution to IGCS, really for your strong effort and outstanding work. Really, thank you on behalf of the entire IGCS Council and to all the patient associations that are following us and they are following you for your leadership position that you have in advocacy. Really, we really appreciate your hard work. We will now transition to the IGCS annual business meeting, and this is a recorded meeting. Good day and welcome to the 2020 business meeting of the International Gynecologic Cancer Society. We welcome all members of the society to this meeting. The following is our agenda for this business meeting of the society. You will hear updates from IGCS volunteer leaders about our finances, journal, and major programs. First, Dr. Andreas Obermeier, our Secretary-Treasurer, will present a report of the Society's financials. Andreas.
Thank you, Roberto, and hello, IGCS members. I first would like to thank Anuja Shingran, who has been the Secretary-Treasurer-elect with me these past 2 years. It's nice to have someone to share ideas with and monitor the Society's financials together with staff on a regular basis. The IGCS continues to be a strong and vibrant organization. The Society is growing and becoming more and more complex in our activities, and this requires adhering to strict financial and accounting procedures. We have an annual audit of our finances in accordance with accounting principles generally accepted in the United States. Each year, the auditors share their findings, and we are fortunate again in 2019 to have another outstanding audit of our financials. I would like to bring to the members' attention the statement of functional expenses. This statement details the total expenses the Society used in 2019 to pay for program services that directly benefit members of the Society and fulfill our charitable mission versus support services, which are those expenses to run the day-to-day operations. In 2019, the Society had a total of 1.412 million in expenses, and those expenses are broken out into support services being 32% of the ration and program services at 68%. This is a favorable ratio for an international organization and fits well into best practices for non-profits. For comparison, in 2018, IGCS spent 31% on support services and 69% on program services. The following is a look at the Society's revenue. As you can see, in 2019, the total revenue was $975,000. You might remember in 2019, the annual meeting was in Rio de Janeiro, and it was not a revenue-generating meeting. As stated over the last year, the IGCS Council is committed to having our annual meeting from time to time in locations that will cause the meeting to be budget neutral to fulfill our educational mission globally. In years like these, the Society will find ways to decrease expenditures moving forward. Thank you for paying your dues. We're grateful for this continued support. And as you can see, the majority of revenue is from membership dues. You will hear from Pedro Ramirez shortly about our journal, but it is another large source of revenue to the Society. Finally, thank you for registering and participating in our first ever digital meeting. We have been asked several times by members why IGCS did not make this meeting free to members like other societies. Our answer to this question is simple. The IGCS business model is such that we have a very low-priced due structure to allow for global participation in the Society, generating less revenue than what most societies receive in dues income. We rely on our annual meeting revenue to support the many of the programs of the Society. We were pleased to offer the meeting at a very discounted price this year. Finally, I would like to review the Society's investments. As you can see from this slide, IGCS continues to maintain strong assets, totaling at the close of 2019, $2.2 million. The markets continue to be very favorable. We invest wisely, carefully, and fortunate to use the interest gained to fund additional important programs from time to time. It has been a pleasure to serve as your Secretary-Treasurer over the past 2 years, and I feel most confident in handing this role over to Anuja, and I wish the Society all the best in its continued work. Roberto, this concludes my report. Thank you.
Thank you, Dr. Obermeyer, and thank you for your years of service to the Society. I now introduce Dr. Pedro Ramirez, Editor-in-Chief of our journal, the International Journal of Gynecologic Cancer, to give his report. Pedro?
Dr. Angioli, thank you so much for this opportunity to report to the IGCS membership on the success of the International Journal of Gynecological Cancer. First, we're extremely happy to report on the fact that we have had an increase in the impact factor with the most recent impact factor of 2.095, and this is an increase from our previous impact factor of 1.7. So we're certainly very excited about the positive change that we have seen in the journal thus far. In addition to that, we have seen that there has been an increase in the 2019 immediacy index. The immediacy index is the number of citations that an item has been published in that year over the number of citable items in that same year. And as I mentioned, for us, we have seen that our immediacy index has gone on to 0.652. In comparison to the last 3 years, we have seen an increase, and we're certainly very happy and proud to report on the fact that the journal has continued to improve, and we certainly look forward to further improvements in the coming years. We're also very happy to report that the journal website has had a significant amount of users and visitors to our webpage. As you can see here, this is a representation of the year 2019 in blue, and then subsequently the year to date in 2020. And we have continued to see a rise in the number of users to our website. In addition, we have similarly seen an increase in the number of article views in comparison to 2019. And certainly this reaffirms the interest in the authorship in visiting our website in the International Journal of Gynecological Cancer. We have certainly also seen a tremendous amount of interest in many of our articles. These is a representation of the most accessed article. As you can see, the enhanced recovery guidelines that were published in 2019 have been downloaded over 54,000 times. So certainly we're very, very pleased with the uptake of the work that is being published in the journal. As it pertains to submission statistics, we have maintained an acceptance rate of 30% or so in the last year, and we're very, very pleased to see that we're seeing an increase in the number of submissions to the journal, not only in original research, but in a number of other article types that are received in our journal. One of the other things is that the representation of submissions and accepted manuscripts is a global representation. And as you can see from this slide, Europe and North America, as well as Asia, have had a very strong representation in terms of the submissions to the journal. And we look forward to increasing our submission rates and hopefully acceptance rates from South America, Oceania, and Africa. In addition, we're very, very happy to report that particularly for our authors, there has been a significant impact in terms of the time to decisions on the manuscript. And as you can see here, the average time to first decision on a manuscript is 18 days. We have a category of reject without review that on average is 5 days. And this is authors are notified whether their article is going to go for formal review or whether the article will not be submitted for that formal review. In terms of time for review decisions, generally it's approximately 30 days. Time for reviewers to complete the reviews is on average about 2 weeks, which is certainly quite impacting, and certainly it's an opportunity for our authors to learn and hear from the reviewers within a very quick time from submission of the manuscripts. And then overall time to acceptance, then this includes the entire processing of the manuscript, is approximately 57 days. We have also had a very strong social media platform. In 2019, our podcasts were listened to over 24,000 times, and certainly we're on mark now to exceed that in 2020. In addition, our video articles have also been very, very popular, and we have had a strong following in both the Twitter and the Facebook platforms of social media. In terms of our future plans, there are a number of initiatives that we are planning for 2021, including a new section called Pathology Archives, another section called IJGC Images. In addition, we will have a series of podcasts with legends in gynecologic oncology, individuals who have made an impact in the field of gynecologic oncology. We're going to have a series of video didactic lectures that are certain to be quite impacting in terms of their training capacity. And in addition to that, we will have a monthly table of content podcast that are put together by the International Journal's fellows. We're also looking forward to a special issue on fertility preservation that will be published in the spring of 2021. And we're continuing to update our website as well. So we're very, very excited about all of the changes and the success that we have had thus far in the journal. And we look forward to another very successful year. Thank you very much.
Thank you, Dr. Ramirez. The Society is grateful to you and the editorial team and all the hard work you are doing. It's impressive what you all have accomplished this last year. Now I would like to review our membership numbers from this past year. We are the largest gynecologic oncology organization globally, representing our specialty and all those involved with caring for women with gynecologic malignancies. It is just outstanding when looking at this map to see our society's membership and how far-reaching the IGCS is globally. We continue to be strong with over 2,800 members in 109 countries. We did, early in the year, exceeded 3,100 members. But due to lack of dues payment, those memberships were terminated. Please pay your dues for 2021. The Society depends on this revenue to fund so many of our important programs. We are very pleased with our distribution of members throughout all the regions of the world, again, truly making IGCS a global society. And this concludes the membership report. Next, I would like to invite Dicey Scroggins, our Director of Global Outreach and Engagement, to provide an update to our advocacy work this past year. Dicey.
Thank you, Dr. Angioli. Hello. It's my pleasure to provide a little information on the IGCS advocacy programs. I'm going to start with a quick review of 2019, when advocacy programs truly took root at IGCS. Now, to be clear, IGCS has had a longstanding commitment to patient advocacy, but advocacy formally became embedded in IGCS programs in 2019. And although IGCS has always had a presence of advocacy on its website, we have enhanced the level of information and the resources, making them more valuable to those people seeking information on gynecologic cancers. During the global meeting in Rio, we had a survivor caregiver symposium that increased health literacy around gynecologic cancers and empowered greater advocacy. And we also established the IGCS Distinguished Advocacy Award to recognize outstanding advocates and advocacy organizations. It is the first international award of its kind. Our global outreach and engagement, including connecting with and forming high-touch relationships with advocates and advocacy organizations around the world, and laid the groundwork for the establishment of a global advocacy network. So building on the foundational work of 2019, this year, we established the first strategic advocacy partnership with the World Ovarian Cancer Coalition. We will continue to establish these important action-oriented partnerships. We co-sponsored a webinar with Together for Health, again strengthening our connections and organizational relationships with groups that focus on women's health and other issues relevant to women. And another important initiative that I'd like to just share with you is the Global Patient Perspectives Roundtable Series. It was established as a forum to share information and to exchange information between patient communities and other healthcare stakeholders. We envision these as in-person meetings. However, due to the requirements and safety related to COVID-19, they have become virtual. So we were very quick to adapt to the situation, and we will change as the situation alters. In connection with the global meeting this year, we are hosting several virtual events for advocacy or for advocates. We'll have a survivor caregiver public summit, which will focus on education across survivorship, the science, and advocacy. And this will be on September 26th. We'll have a roundtable. We'll also have a joint art project to which any and every single person who attends the global meeting is encouraged to contribute. And in our second year of the Distinguished Advocacy Award, we received outstanding nominations from every inhabitable continent. And it was a very difficult choice to choose the three phenomenal advocates and advocacy organizations that received the award. Through advocacy, we took the lead in drafting a summary statement highlighting IGCS support of and work toward global health equity. Many of IGCS programs and initiatives already align with this important stance. Through our outstanding process and an ongoing process of regular review and enhancement of the website, we provide increasingly important and valuable information and resources to patients who are seeking reliable, vetted information and who want and need to connect. And with the groundwork already laid, we anticipate launching the Global Gynecologic Cancer Advocacy Network later this year or early in the first part of 2021. These initiatives are undertaken with exceptional support and commitment by the IGCS leadership. Thank you, Dr. Angioli. This concludes my report.
Dicey, thank you very much for bringing advocacy so strongly into the society. This is very important to our patients and their families and to the IGCS. Now, Dr. Kathleen Schmaler, Chair of the Mentorship and Training Program, to present her report, a very robust and busy area of the society, to give us an update on their activities. Okay.
Thank you, Roberto. I'm going to speak on the Mentorship and Training Committee. Our committee is co-led by Dr. Lina Schwang, Dr. Thomas Randall, Dr. Joseph Ung, and myself. Our biggest project is the Global Curriculum and Mentorship Program. This is a 2-year gynecologic oncology training education program for regions of the world that don't have this formal training. It's a web-based curriculum that can be modified by each of our sites, and we match institutions and individuals from programs and regions with formal gynecologic oncology training with partners in regions without, so a twinning model. The goal is for each site to train 1 to 2 fellows per year. We have monthly Project Echo virtual tumor boards that last an hour with 45 minutes of case presentation and discussion, followed by 15-minute didactic lectures. All our fellows at the end of the 2-year program take a final exam, and we have a separate exam committee for this. A lot of the teaching is hands-on training, primarily surgical training, with the international mentors traveling to the sites in each of the countries, and then also our international fellows visiting the higher resource setting for 1 to 3 months. You can see here teaching both in the operating room as well as some hands-on teaching for LEAP and colposcopy and management of pre-invasive disease. In the coming year, we'll be starting a formal training program for pre-invasive disease with colposcopy and LEAP. Our results to date, we have 12 collaborative fellowships. We have 30 fellows in training. We graduated our first 3 fellows in 2019, and we'll have 3 to 6 fellows taking the final exam in 2020. We have 25 international mentors and have had more than 50 site visits per year. We have 24 local mentors in each of the fellowship sites. There have been more than 3,600 gynecologic oncology surgical cases logged by our fellows. So these are cases performed by our fellows at their home institutions with the support of their local mentors, as well as their international mentors. More than 240 Project Echo tumor boards have been held with more than 300 patient cases discussed. And there have been more than 40 publications and presentations submitted by our IGCS fellows since the start of the program. A quick update during COVID-19. Obviously, our international fellows are not able to travel to each of the sites, and our fellows are not able to visit us at the higher resource settings. However, we have continued much of the training virtually. Our Project ECHO sessions continue monthly for each of the sites, and many of our fellows are actually joining other sites' ECHO sessions for additional training. The international mentors and local supervisors have been conducting additional online training sessions due to the travel restrictions. Our final exams, which were previously held in person, are now being held using the Zoom technology, similar to this meeting. And we are providing additional training relating to research and abstract manuscript writing for the fellows. In addition, all our fellows have been given access to up-to-date to further their learnings as well, given that many of the textbooks, et cetera, cannot get to them. And that concludes my presentation. Thank you, Dr. Angioli.
Just outstanding. Thank you for that report, Kathy. The Society is indebted to you and all the volunteer leaders who are committed to the success of the program. It is now my pleasure to invite Reid to give the report of the Education Committee.
Hello, IGCS members. My name is Reid and I am the chair of the Education Committee. I would first like to acknowledge Ann Gerda Erickson as our vice chair and all the volunteer committee members. We have over 55 volunteers participating in various work groups of this committee, and I'd like to thank all the committee members for their hard work and dedication. The main focus of our committee is working to further develop the online education portal, where members can access educational content on a variety of gynecologic oncology topics. This is being spearheaded by the Gynecologic Oncology Work Group led by Jessica McAlpine. Based on our educational needs assessment, the desire for surgical videos was evident. In May of this year, we launched the IGCS Surgical Film Festival series, where expert surgeons from around the world share surgical videos and narrated procedures for a unique learning experience. Since May, we have continued to host film festivals on ovarian cancer, sentinel lymph node dissections, and surgical complications. We plan to continue this series this fall and welcome ideas for session topics. In addition to our film festivals, another surgical opportunity is the availability and access to Surgery U, which houses thousands of videos you can watch on demand and is done in partnership with AAGO. A big thank you to Vance Broach and his Surgical Videos Work Group, shown here, for taking ownership of this initiative. We have also continued work on our palliative care curriculum. Our committee work group, led by Michael Pearl and Raimundo Correa, has worked extensively at putting together an online certificate program. The program will consist of 10 modules on various topics, all focused on palliative care for the gynecologic oncologist, and will feature quizzes, case vignettes, and more. I'm excited to share that this will be available for members very soon. Another area of development was additional education and resources in pathology, thanks to the hard work and dedication of our pathology work group led by Anna Plotkin. The IGCS portal now features a dedicated pathology corner with open access for our members. This is an area focused on pathology education, curated specifically for gynecologic oncologists, and has a glossary, custom presentations, and literature. One unique offering is the Ask a Pathologist feature, where you can submit questions and receive answers from our volunteer leaders. I encourage you to check out the Pathology Corner if you haven't yet. Similar to the pathology work group, we also have a radiation oncology work group focusing on tailoring radiation oncology information for the gynecologic oncologist, and this is led by Dr. Remy now. These resources are still in development, but will be available in late 2020. We have been busy creating relevant and timely education for the IGCS membership and hope you have found these offerings of value. Stay tuned for even more exciting things to come before the end of the year, including a formal learning management system. I hope you continue to take advantage of these offerings as part of your membership. Dr. Angioli, this concludes my report.
Thank you, Dr. Salani. The Education Committee has done great work this year. We look forward to more excellent education in the coming year. Concerning new business, we did not receive any new business for the Society. I would like to take this time to thank those council members of the Society who have served with me over the past 2 years, and some even longer. Some of you are ending your terms and others are staying on for another 2 years to complete your terms. Thank you to all of you who have worked so tirelessly. The Society continues to flourish and grow under your leadership. Next year in Rome, let's celebrate the success of the Society together. Finally, one of my final acts as a president of the Society is to introduce and hand over the presidency to Dr. Roberto Coleman. Bob will do an outstanding job and the Society will continue to flourish and reach its potential globally.
Thank you so much, Roberto, for your mentorship, your guidance, and your leadership, not only over the years of your presidency, but also those many years that you've dedicated to the Society in your many functional roles. I'd also like to thank you for sparing no expense in sending me the presidential gavel, which I will use to terminate the business meeting shortly. I'm very excited to be involved in this Society. Remember, this is your Society, and please feel free to reach out to me and any of the members of this council with your ideas and feedback so that we continue to mold and shape this community to you. Over the coming year, we're going to take advantage of our new facility with video technology and remote meeting to try to engage and keep us together, Society. I think most of you who know me and the members of this council really feel the need to be able to connect with you. And because we are such a global society, we're so fortunate to have the opportunity to leverage this technology so that we can stay together until we meet together in person. Roberto, thank you for the kind words, and thank you for welcoming me to this to take the charge of this great organization. So as my official first act as president, I will bring the 2020 business meeting of the International Gynecologic Cancer Society to conclusion and adjourn. Thank you, and enjoy the rest of the meeting.